You are listening to Cognitive Behavioral Therapy, 99 plus healing strategies to reduce depression, anger, and stress. Written by Michael Samba. Narrated by Ryan Whiting and Peter Prova.
Introduction. Cognitive behavioral therapy deals primarily with addressing the negative patterns in the way that a person sees himself or herself and the world. This is an issue of perception on the part of the person who has a diagnosis of an anxiety disorder or of a depressive disorder. It also focuses on the distortions that may emerge as a result of these negative patterns of thoughts and perceptions. The goal of cognitive behavioral therapy is to adjust the thought patterns and behaviors that cause a person to perceive things in a negative manner. That, in turn, cause the person to experience the difficulties that he or she possesses. In changing these patterns of negative perception, the person can change the way that he or she feels, and then will be able to begin to make changes in his or her patterns of thoughts and behaviors that will continue the cycle of more positivity in his or her life. How does cognitive behavioral therapy work? Cognitive behavioral therapy is a very commonly used form of psychotherapy. This specific form of therapy treatment can sometimes be even more beneficial when it is combined with other types of treatments, such as with the use of antidepressants or other prescribed medications. A central focus in cognitive behavioral therapy is to assist people in becoming aware of when they perceive things in a negative manner and to make interpretations of what has happened based on these negative perceptions. In general, patterns of behavior will reinforce the distorted thought processes and thus continue the cycle of distortion. The goal of cognitive behavioral therapy is to break this cycle with the introduction of behavioral changes that the patient will be able to utilize in all future interactions that occur. Cognitive behavioral therapy is a therapeutic treatment option that aids people in understanding the negative feelings and thoughts, and the distorted ways in which they influence their resulting behaviors. It assists people in developing different ways of perceiving situations, achieving different thought processes, and learning different behaviors, which all have an end goal of reducing the overall psychological distress that the person feels. This type of
sample complete. Ready to continue?